Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'm talking about whether nebulizers are better than inhalers. I received these questions today and I thought I need to make a video about this because it's really, really important. It's something that I think many patients do feel that makes sense, but I'm not sure if that's the case. So nebulizers, as you probably know, are these devices that you generally plug in, you put some solution in a little mask, you press a button and it just releases this mist that you're inhaling as you're breathing normally through that mask or through that little pipe. It sounds great because you're getting medication in the lungs. You can see the medication, you can see that mist coming up. It looks like a ritual as well. So I think that's one of the reasons why patients think these are the top treatments we can take for the lungs. But at the same time, I would like to just remind you that the inhalers that we have, various kinds of inhalers, they are actually, the modern ones especially, they are very advanced. So we now have inhalers that can contain up to 3 types of medication. So imagine you're getting a lot of treatment in a little small puff. So that's something that we need to consider. So the advances that we've had in this field are amazing. And what we have as solutions to put in nebulizers are nowhere near as good. So we have a much more limited array of treatments that we can use in a nebulizer compared to what we can use in inhalers. Now, there are indications for both. So they both can be useful. But I would say for 90% of the people who are suffering with asthma, COPD, things like that, and they want to have good control of their condition, just using inhalers is probably enough. In some circumstances, using nebulizers is with specific types of solutions, and I'll detail this in a little bit towards the end of the video. When you're using nebulizers with certain solutions, you are really trying to use them in specific circumstances. So let's delve a little bit deeper. Generally, why inhalers, I think, are a little bit superior to nebulizers. So like I said, you have more options in terms of devices. So you can find one device that generally works for you. You can have more types of medications that you can find in inhalers. Some of these medications can have short durations of action. Sometimes they can have long durations of action. So you can have inhalers that you only need to use once a day and they still have an effect. That's not really the case for nebulizers, right? So the other thing is with inhalers, you're inhaling a very precise dose. So when you actuate the inhaler, when you release the medication, you know how much you're getting generally. With nebulizers, it's a little bit more variable because basically when you are turning on the nebulizer and you're trying to inhale that solution, you can imagine that keeps going and you tend to breathe faster or slower, deeper, more shallow breathing. You may have diluted the solution in a different way. So you're not entirely sure how much you're getting. And sometimes you can get a lot more than you need with the nebulizers, but that just depends on the indication. Sometimes the dose itself doesn't have to be that precise, depending on why you're using that nebulizer for, but it's less precise than with an inhaler. The other thing is, with the duration of action. I don't know if I've mentioned this before, I forgot. So basically, the duration of action in inhalers is really important because you can have the whole range. You can have inhalers that have a bronchodilator effect, so keeping the airways open for a short duration of time, so 4 to 6 hours, 12 hours, 24 hours. So you can tailor a treatment depending on the patient's needs. So that's really, really important. Now, coming back to nebulizers, when would we use nebulizers versus inhalers? The big drawback to inhalers sometimes is that because we are using a device, we're not just taking a tablet or something like that, and this is the case for all respiratory conditions treated with inhaled medication. With inhalers, you tend to sometimes have people who struggle with inhaler technique, and this is usually more common in people who are of the extremes of age. So young children sometimes struggle with inhalers. Older people also struggle with inhalers. Sometimes it's just the way it is. Sometimes you can get past that with more training, but at some point, some people just have devices that they just cannot use. Sometimes you cannot synchronize your breathing with the inhaler, so especially with the puffers, the ones that when you release the medication, you have to catch it from the air, sort of. You need to inhale it in the correct way. Sometimes just that synchronization can be difficult for some people. That's where nebulizers may help a little bit. And I would say in people who have issues with joint problems, things like that, their fine movements are not very precise. They may have anxiety, they may forget things. that's when, using inhalers can be a little bit difficult. And it's also the case that someone else cannot really use the inhaler for you. Whereas if you're caring for someone and you can just turn on the nebulizer and, give them the medication as indicated by the doctor. Now, let's go back to nebulizers a little bit. So the nebulizers are helpful in those situations where inhaler technique can be difficult. So, for example, if someone is having an asthma attack and they just cannot breathe, they really cannot synchronize their breathing with the inhaler, they're trying to get that reliever in, then they cannot do it. Just starting the nebulizer and just slowly breathing normally can help open up the airways. So this is a good indication for using a nebulizer. Generally for children, sometimes it can work to treat, for example, childhood asthma, especially if the child is struggling with inhalers, so you may help your child with the nebulizers to help treat their condition. But other than that, I would like to just say that pharmacologically, we have a much less vast range of medication for nebulizers. So this is a problem. Because like I said, with the nebulizers, if I'm trying to, work with my patient, for example, and have a treatment plan for their asthma, if I were to use only nebulizers, I would probably need to prescribe using that nebulizer quite a lot of times during the day to control their illness. Whereas with inhalers, I may find a solution where they only need to use an inhaler once or twice a day. So it's a little bit different. We don't have that whole range of solutions that we have in inhalers. So the progress in the field of inhalers has gone up like this. In the field of nebulizers, not so much. And the other thing that's a little bit difficult with nebulizers is, like I said, you're not entirely sure how much you're getting in terms of precision, in terms of how much medication you are getting at one point. Now, let's talk a little bit about using nebulizers with saline solutions. So I know some patients want to use them for that reason, to help them bring up phlegm. I would say it doesn't help in most people. It depends from person to person. It can make a difference, but generally just keeping well hydrated and having good chest clearance techniques can actually be more helpful. Nebulizers do play a role in those situations. Sometimes your doctor may recommend using hypertonic saline. So this is a higher salt content saline solution. But you need to check with this one, because check with your doctor first, because if you're just putting the hypertonic saline in the nebulizers, you may end up irritating the airway more and actually coughing more, or having a bit of a bronchial spasm where you may need to use an inhaler or the nebulizer again to combat that. So you need to be quite careful. So there are no perfect medications in medicine, unfortunately, especially in the field of respiratory conditions. To be honest, it's great that we can use inhaled medication that we inhale directly in the lungs, in the airways. But at the same time, that makes it a little bit imprecise, because everyone's breathing varies from one breath to the next. So you can imagine, from one inhalation to the next, from an inhaler, you always have a little bit of imprecision. I would say overall, nebulizers are actually not pharmacologically superior to inhalers. Inhalers are probably better, but there are instances when you need to use the nebulizer because you may not be able to use the inhaler. So I would say, work with your doctor, see if you need to have both or just one. Or so, for example, do you just need the inhalers, or do you need to have the inhalers and maybe have a nebulizer at home just in case you might need it, as a backup in case you cannot really use your inhaler for some reason? Or if you're helping to care for someone, do they need and you need to help them? Is there a way to tailor the treatment for that person so that you're only using nebulizers? But I would say with inhalers, you have more precision and potentially less complications, less ritual around how you're using treatments. It's a little smaller, it's a little easier to use. Whereas with nebulizers, you have to do all this jazz where you have to, turn on the nebulizer, put the solution in, wash the masks really well, because hygiene is really important. With medications that you are delivering in a solution form. So it can be a little bit more complicated to use nebulizer. Use it, of course, if your doctor has indicated that to you, and if that's helping you, of course, that makes sense. It's a valid form of treatment. I think it can have a bright future ahead, especially for delivery of certain drugs to the lungs. We are working. There's lots of research in that field to try to develop better delivery devices for putting the medication where we need it in the lungs. But at the moment, I would say the development of inhalers has reached a point where we have so many options. There's probably a device that you can use well, especially with the right training. And you may just find it easier to do that rather than to use the nebulizer, which is a complicated device that requires a lot of maintenance and care. So I hope this was helpful. I didn't really script this video, so apologies if I went from one topic to the next, but I think it covers most of my thoughts surrounding this issue. If you want me to clarify anything else, please let me know, and I'll try to make another video to do that. Thank you very much for watching. All the best. Good health.